Hello everyone, you are all welcome to lecture number 1278, and today's topic is Parkinson's disease, its symptoms and treatment and also causes. So when we are saying Parkinson's disease, it means it is neurodegenerative disease and some neurochemicals are disbalanced and their production is reduced, and because of that reason the neurotransmitting or messages are not carried, and people they suffer from different body condition like shaking of hand, that is called tremor, and also slow movement, stiffness of bones and muscles, and it is a very serious condition. And this condition starts mostly after the age of 60 because it is known as old age disease. And if we are not taking care of our diet, lifestyle, then the situation may aggravate. And if I am saying diet means, which is very important, to take such type of nutritional food or diet which is the rich source of omega-3 fatty acid, antioxidants and anti-inflammatory. So such type of foods are available, and these foods are nothing but colored fruit and vegetables. Those which are colored like deep yellow, deep red, blue color fruits and vegetables, they are rich source of flavonoidal compounds, and flavonoids are very powerful anti-inflammatory and antioxidants. So if such type of foods are taken, they can reduce drastically the condition of oxidative stress, and that oxidative stress can damage your neuron cells, and also that can help in build-up of neurochemistry. If I say neurochemistry means production of dopamine and serotonin. These two chemicals are neurotransmitters, and once their percentage production is fall in our brain, we are going to suffer from this type of disease, that is called Parkinson's disease. In Nigeria, more than 100,000 people every year they suffer from Parkinson's disease, and in India 8 to 9 million people they are suffering from Parkinson's disease, and it is very much painful to family members because it is in stages: first stage, second stage, third stage, fourth stage. So in first stage, slowly stiffness will start, and even sometimes they may not understand. Then second, third stage, some body posture disbalance, body balance will not be there. Sometimes it will be difficult to hold the cup. You may feel that it is stiffness. You will just we do some exercise, and then in advanced stage, final stage, you are totally crippled. You are on your wheelchair and you cannot move, you cannot stand, your body posture, balance is totally disturbed, you cannot hold the cup or any item, and you are seriously, the liability to your family members is very painful. And nowadays, there are a lot of medication, chemotherapy, a lot of drugs are available, anti-inflammatory, and then antioxidative stress. But at the same time, there is a lot of research going on where they are targeting with the help of gene therapy, with the help of stem cell treatment, and also immunotherapy. Now we are doing surgery also just to activate the nerve and brain cells. So lot of research work is also going on how to control, how to manage, how to treat such type of disease where the productivity of human being is in question, and at global level millions of the people are suffering. I have already told you that only in India, 8 to 9 million people every year, they suffer from such type of health condition like Parkinson's. So I am showing you some of the images. So this image, very clear indication how his whole body is affected by degenerative neuro disease that is commonly known as Parkinson's disease. Even his hand is weak, is shaking, tremor is there, his neck is bent, his back is bent, his leg is bent, all are stiff, all are disturbed, and his body posture, body balance is not there, and even his movement is very, very slow. All are seized. This is terrible condition that is known as Parkinson's disease, and he is suffering from advanced stage. So once it is in advanced or chronic condition of Parkinson's disease, even it will be difficult for you to hold a spoon or even cup, and you need the help because there will be a lot of shaking that is called tremor, and because of that it is not possible at all to hold, and you are totally crippled. You cannot eat, you cannot hold, you cannot do any work because degenerative neuro disease, Parkinson's, will not allow your all body flexibility and mobility in normal condition. Here, very clear picture. The stages are shown. First stage, you will start feeling little stiffness and slow movement. Then second step, your body posture will be disturbed and it will be disbalanced. And then third step, again more stiffness and your movement will be restricted. And finally, you are sitting on wheelchair and you are not capable of doing any work. You are fully dependent on somebody to support your life. This is the chronic condition of Parkinson's disease. So here the summary is given of lot of research studies. Number one, Parkinson's disease is a degenerative condition where your nerve cells, your neurons, transmitters, motor cells, serotonin, dopamine, they are all disturbed and they are degenerated, their production is not there. And that occurs mostly in the people who are above the age of 60 years. In Nigeria, 100,000 people get this disease every year, and in India, it is 8 million every year. Number two, Parkinson's often starts with tremor, shaking of your finger and hand in one hand, and the other symptoms are low movement, stiffness in whole body. And I have already shown you the photo and the images, how in stages it starts, stage 1, stage 2, stage 3, stage 5 means where he is sitting on a wheelchair, he is totally collapsed and in surrendered position, and he needs somebody to support his life. A slow movement, stiffness and loss of body balance, that is posture, you will be going down like this slowly. It is also to the nerve cells, damage is in the brain. Damage in the brain is the main cause of Parkinson's disease. And number 3, also dopamine and serotonin drop in the brain. When there is drop in the production of these two are very important neurotransmitters, dopamine, serotonin. They are also known as mood hormone, or we can say happiness hormone, and they also contribute. If their production is less in our brain, definitely you are on the road of Parkinson's disease. So that is very important, these chemicals in serotonin drop in brain leading to the symptoms of Parkinson's disease. A. Main causes. So I have mentioned some main causes. Definitely first is age factor, above 60 years. Number 2, brain and medicinal chemistry. I have already told you the medicinal chemistry inside the brain is playing very important role. That is, enough production of neurochemicals are not there, like dopamine, serotonin, and the third one that is called acetylcholine is also very important neurochemical. The third factor is environmental factor. Once in your air or environment where you are working, there are a lot of pesticide, insecticide manufacturing, or lot of heavy metals are there in the air. That also can cause the damage and degeneration of your nerve. Then B, what are the symptoms? So the main symptoms are tremor, the shaking of the hand, arms, legs, and even jaw. Your jaw will not be balanced. That's why it will be difficult for you to talk, to communicate. Number 2, rigidity of muscles and stiffness. Number 3, slow movement, and that slow movement of your body, that is called in medical term body kinesis. So body kinesis is the slow movement of your body. And number 4 is body balance problem, that is your posture. And number 5 is memory. You will not be always concentrated, and you will not give any attention much. That is also the symptom of Parkinson's. 6, mood change. Mood change always, you are irritated, you are in depression, anxiety built up. The reason is that in your brain, once dopamine and serotonin production is dropped, is less, always your mood swing will be there, and you will be having lot of depression, anxiety problem. And then 7, sleep disorder and insomnia, and always daytime fatigue. So once you have this factor that you are spending sleepless night, sleep disorder, and also you feel fatigue during the time, it clearly indicates that in your brain enough neurochemical, especially this serotonin, is not produced, because serotonin is very important for to control your sleep disorder. Then number 8, that difficulty in swallowing, speaking, and also writing. So now I have given some important points how to treat, and some latest research, and some home remedy. So here, C, treatment. So treatment means first dopamine replacement, that's medication, chemotherapy, and that is like levodopa, then dopamine, agno, and then MOB inhibitors, and these inhibitors are selegiline and rasagiline. Then COM inhibitors, they are entacapone and tolacapone. Then you are treated with all these medications. Your neuro consultant, neuro doctor who are dealing Parkinson's disease, they know it very well, and they will take care once you consult them. And then surgery option is there, and that surgery option is first is deep brain stimulation, that is called DBS surgery, to regulate abnormal brain activity. Then second option is that is called pallidotomy. Pallidotomy is to relieve the motor symptoms. Motor symptoms means your rigidity, your stiffness, and to activate it, that is called motor symptoms. And then third option is surgery, that is called thalamotomy. Thalamotomy means to relieve the shaking, tremor. Then D is lifestyle change. You can manage very well by change of lifestyle, and in lifestyle, main is your sleep disorder and diet. So first regular exercise, then balanced diet. If I say, I am always saying balanced diet. There are two types of diets. One is nutritional, where you are taking care of mineral, vitamins, fat, carbohydrate, protein. And the second one is balanced diet. Balanced diet means where you have to take care of phytochemicals, antioxidants, and anti-inflammatory compounds in the food. And there are foods which are very rich source of these two compounds, and they are, I have already mentioned in lecture, during this lecture, they are mostly colored fruit and vegetable. That is antioxidant and anti-inflammatory. Number 3, stress management. Always you manage your stress, reduce, keep away from toxic people and crowd and lot of negative personality. Just lead your disciplined life. And then 4, sleep hygiene. Establish a normal sleep schedule. Normal sleep schedule means if you are going to retire for sleep at 10 p.m., always maintain. It's not that one day at 10, second day at 12, third day at 1, again one day at 9. No. It's just normal schedule. And then home remedy. Home remedy people are using nowadays, like massage. Massage is also good, at least it will reduce the chance of stiffness. Then acupuncture is Chinese therapy. Is very popular in China and in India also. With the help of a small needle, they will target the nucleus of the nerve cells to activate. That is called acupuncture. And other one is that is your that is home remedy, aromatherapy and music therapy. Nowadays aromatherapy, the aroma means with very good perfume, essential oil smells that can also relax your depression, anxiety, and also it can activate the production of dopamine and serotonin, those neurochemicals. And now I have gone through some latest research publications, and they are indicating lot of research is going on to treat and handle the Parkinson's condition. The first is that is gene therapy. If I say gene therapy means your DNA is involved. Deoxyribonucleic acid, that is genetic material, and they are doing sequencing and making some progress in that. That is called gene therapy. The second one is stem cell therapy. Nowadays these two, stem cell therapy and gene therapy, lot of research is going on. Stem cell means your embryonic. Once it is in the form of division, cell division, zygote, by the fusion of sperm means male and egg female, and after that what cell division starts, at that level they are targeting. And then third one is that is immune therapy. So in this way lot of research is going on. So thank you very much for watching the lecture.